And actually I want to thank you, Commissioner, as well. I'm grateful to bring along Deputy Commissioner Herzog, who I think is doing a wonderful job as a Deputy Commissioner. But that being said, good people make bad decisions, and quite frankly, I think you folks are making some very bad decisions. I'd like to just start off and state that these cuts are outrageous. If this was a cartoon, you would see steam literally coming out of my ears. That's how upset I am. When you look at the cuts and how disproportionate it is, especially how disproportionately impacts minority communities. My colleague, Councilmember Tish James, who's a lot wittier than I am, has said that this is the issue of the blacks and the black hats. Because when you look at the specific numbers, and you read off these names, let's just start with the daycare centers, the minority members: White, Sanders, Chin, Dickens, James, Gonzalez, James, Van, Eugene. 11 of the 15 sites are minority members. When you talk about priority 7 vouchers, effectively what you're doing is a minority religious population that, as we all acknowledge, is very, very poor, and you're cutting the only lifeline that they have. Last week I stood along with 9 other members. There were 10 members of the Brooklyn delegation. I want to thank them. We protested this. It was Councilmembers Levin, Fiddler, James, Lambert, Eugene, Nelson, Delon, Van, Williams, and myself. 10 members from Brooklyn who agree that these are disproportionate cuts that are disproportionately impacting racial and religious minorities. If you look at the roughly $1 billion child care budget you guys started off with, and you're talking about the cuts just to, for example, the priority 7 vouchers, because I'm going to allow Councilmember James to elaborate on the child care, you're talking about a cut which, of the 15% of cuts that you need, is essentially, it's 10%. And so, what I'm wondering is, are you familiar with the 2008 report that you folks had, which details unmet needs for children in various communities? Specifically in that report, you identified Borough Park and Williamsburg as 2 communities with the largest need for publicly funded child care. Let me give you a couple of quotes. This is your report, it's on your website. I'm not making this up. First, there are communities like Borough Park, which is distinguished with the highest number of children who are eligible for ACS, early care and education services, and it ranks quite low for ACS services and moderately low for DOMH services. These facts show community need. And then, you turn around and you're cutting the communities that need it the most. And so my question, which I guess is a very specific question to start off with, and I'll have a couple of follow-ups, is how do you address the fact that these cuts are disproportionately impacting religious and ethnic minority communities? That was a question, Commissioner. Thank you.
I'll try to be clear without over-responding. The fact of the matter is that almost all of our centers are minority-led, minority-run, and serve minorities. The fact of the matter is that 64 out of 115 of these expensive lease sites are in Brooklyn, 19 are in Queens, 22 are in the Bronx, 10 are in Manhattan. In order to reach our target, or let me look at just the slots. Brooklyn has 10,000 of the 22,820 in those sites. Queens has 33,000. Bronx has 5,000. The disproportionate impact of this decision is focused on where the centers are now. How they got there, how they were not evenly split up at the time they came into being and got funded by the city, I don't know. But I do know for facing the cut, to simply apportion it across the city would be much more unfair. And in fact, our needs assessment was quite clear that the boroughs underserved were not Brooklyn. The borough underserved most is the Bronx. That's why to take away one of their 22 and one of your 64 in Brooklyn, we don't think is fair. Now, you may disagree, and I don't have a problem with it, how we went about doing this. And you may want to speak up for your constituents But our responsibility is to try to make the best decision citywide.
Well, I do disagree. I think those were bad decisions. I'm going to refer back to your report. In contrast, 73% of children in nearby Borough Park are from low-income families, yet only 12% of eligible children are served with ACS services, and 99% of the slots are filled. So when you're looking about disproportional impacts, I think it is fair to question why certain communities, specifically ethnic and religious minority communities in Brooklyn, are being disproportionately impacted. And I want to speak about Priority 7. You know, we talk about mandates versus non-mandates. If you look at the breakdown of Priority 7, 92.1% of the children, 92.1% of the children who receive these vouchers are living below 100% of the poverty level. Let me remind folks who don't understand what that means. That means these are folks in a typical size, let's say a family of 4, less than $22,000 a year. And not only are you proposing these cuts, you're proposing that these kids have nowhere to go next year. That's ridiculous. I don't understand how you can turn around and say, well, guess what? 2,200 kids, 92% of whom are families who are making less than $22,000 a year. Good luck to you guys. Well, let me explain to you what's going to happen. These kids effectively are going to move on to Priority 5. They're going to have no choice. That's effectively what's going to happen. We set up Priority 7 for specific needs of a community that wasn't necessarily being served, which your own reports highlight were not being served by the current system. And so we set it up to help this community. And now what's going to happen is most of these kids, the overwhelming majority of them, 92%, will end up moving to Priority 5. Because realistically what's going to happen is both parents are going to have to go out to work. They qualify for public assistance. They're going to move to Priority 5, and then you're going to come back and say, well, guess what? We don't have money for Priority 5, so too bad for these kids. How is that fair? How is that fair? We have a question. Commissioner.
You know, I think that what I tried to do is explain to you where we are in terms of our financial situation, where we are in terms of population growth, and where the needs must be met currently. Right now, we don't have the option to say, we're going to jump Priority 7 and start cutting Priority 5 families who are working. That doesn't make sense either. Because then, right, we would be in the same situation, and I'm sure that you would be saying the same thing. But the fact of the matter is, without additional funding at the state and federal level, there are very limited options we have. At the same time, I don't disagree with you that, yes, it could be that some families are going to be displaced and go on to public assistance. I'm not disagreeing with you, but what I'm saying is, at a time where we have 8,500 more children on the mandated side that we absolutely have to serve, and we have to give somewhere because we don't have additional funding coming at the state and federal level, then what options do we have? We don't have many. And I will say that for all of these times where we've had these growths, overall, the mayor has given money. When we had the market rate increase, the state put on us a mandate to provide almost what was $60 million in retro costs to pay higher rates at a time when we had to cut significant amount of subsidies. We were talking about cutting 10,000 subsidies. That would have affected much more than Priority 7. The mayor put up $25 million in the baseline to avoid that problem. So we've continually been in a situation where the pressure's on the city to do so, but there's only so much the city can give at a time where we're also in crisis as well. And, you know, there hasn't been much pressure at all at the state and federal level to really come up with more money, and the state budget doesn't look much good either. So again, I'm not denying the impact that this will have on families. What I am saying is there are very, very limited options in such a tight fiscal environment. And we have to go with where we have to cut based on the lowest priority up. And again, we can talk about Priority 7, we can talk about child welfare. In my view, they're all priorities of families that need child care. Obviously, they wouldn't be with us if they didn't. But unfortunately, the decision has to be made.
Well, first of all, I'm glad that we both agree that the responsibility is on the mayor to come up with the funding. And I would agree with you on that, Deputy Commissioner. These cuts are,
That's clearly not.
If
you want to make a speech, we can make a speech.
Commissioner, it's not a speech. You know, for you guys, this is academic. For me, this is the life.
It is not academic. I've given my life to this work. It is not academic.
Let me finish my point. Let me just finish my point and be my final question / statement, okay? If you look at the child care centers closing, you're talking about a total of 1,165 kids altogether who those centers are going to be closed, and we're now going to be pushing those kids to different centers, which is unacceptable, but they may have at least some lifeline. You know, yesterday my colleague Inez Dickens was rightfully outraged that 7 senior centers in her district are going to be closed, and hundreds of seniors are going to be displaced, disproportionate. Do you have any idea how many kids in my district are going to be displaced? 1,330 children. That's more than all of these children combined. And so for me, it's an outrage. And I can't come to the city council and have a nice, polite conversation when you're coming into my district and you're telling 1,330 children, tough luck. The economy is bad. That's simply unacceptable. And so I will reiterate, the obligation is on the agency, the obligation is on the mayor, the obligation is on the city to do what they can to fund these kids, because you cannot tell 1,330 kids in my district, which is a larger number than all of the child care centers in New York combined, go to heck. It's unacceptable, and I am very passionate about this, and this is definitely not an academic issue.
Commissioner, would you like to respond? Okay, we'll move on to the next question.